And welcome back. Well, viewers, now there is a certain little thing that's been circulating on social media, a certain comment made by one of our independent senators, and we are getting a chance to connect with him and to hear his views a little bit more on this. Now, I'm speaking here about Dr. Paul Richards, Senator Dr. Paul Richards, and of course a comment that he made a couple years ago in the Senate in regarding smoking, in his belief that smoking should be banned completely in Trinidad and Tobago. So to give us a better perspective and some more details, we have Dr. Paul Richards on the line with us this morning. So good morning and welcome to you, Dr. Richards. How are you doing?
I'm fine, thank you. Good morning, Kandace, and good morning to your viewers and listeners.
Such a great pleasure to have you this morning. Now, of course, you made this comment a couple years ago at the Senate proceedings, but it seems to have gotten some more steam in recent times and some more circulation in recent times regarding your views on why we should be banning smoking in Trinidad and Tobago. So first of all, I want to get from you, why did you make those comments?
Well, I have seen over the years, and let me say, I believe in adults' right to choose how they want to indulge, what they want to indulge in. It's a democratic society. Adults have the right to choose what they want to indulge in many different areas in life, not only in Trinidad and Tobago, but around the world. But I have firsthand seen the damage that smoking does, and secondary smoke in particular, to the lives of many, many, many countless people, thousands of people. And more, smoking, although it's illegal for minors, is making its way into the hands and mouths and lungs of young people. Uh, when that statement was made, it was a general statement in terms of my personal perspective on smoking. Not necessarily always translatable to the wider population, but that's just my personal perspective. And in more recent times, I've also had a firm belief on the issue of vaping because I'm also seeing the damage that vaping is doing, which is usually stated to be safer, erroneously so. And it's more, as the young people say, sexy now to have a vape machine or a vape device, which many young people are entertaining and putting THC and other substances in, which is posing a threat to their health and in many cases their lives. So I think the information on smoking, while on the packages about the potential, or I shouldn't even say potential, the dangers of smoking, including the number of carcinogens that are involved in smoke cigarettes and the damage it does to people's lungs and health and the impact on the national healthcare system, and also the ability of cancers that may start in your lungs, spreading to other parts of your body and putting a strain in the healthcare system and your own personal health, and also in terms of young people accessing cigarettes illegally and smoking in terms of vaping. I have very strong personal views on that.
And is it that you are just advocating for the outright ban of cigarettes only, or is it including cigars and the whole line of it?
Well, tobacco products, and I know it's a big thing in the UK right now. Maybe that's why the clip has started to circulate once again, because I'm looking at the UK Parliament in the last couple of days, and the UK Prime Minister Rishi Sunak and this party advocating a ban on cigars under certain circumstances. So I guess maybe that's why the people searching cigarette bans. My clip may have come up, but I doubt very much my call will take any root in Trinidad and Tobago, because the smoking lobby, or the tobacco lobby, I should say, around the world is a very, very powerful lobby. And yes, they've done a lot of work in terms of educating and public awareness about the dangers of smoking, even putting advisories on cigarette packs as part of the legal framework, even banning advertising of smoking as part of the legal framework, which are all commendable. But it's not necessarily redounding to reduction in smoking in minors and or adults.
And you said something interesting also when you made the original comment, and is that companies such as Whitco and so on, they're perhaps too rooted or too embedded within our economy for us to sort of let go, or for us to change the way we treat with cigarettes and so on.
But yeah, I mean, they are not doing anything that's not within the legal framework. Let me put that. I'm not saying that they're operating illegally. They're certainly operating legally. they adhere to the rules and regulations regarding the importation and or production and retail distribution of cigarettes. In most cases, they of course are the cases where minors get access to cigarettes because the minors don't import the cigarettes that they're smoking themselves. And I think more oversight needs to happen where retailers are concerned, or or there needs to be more oversight in terms of application of laws against minor smoking, and also more advisories and public awareness regarding the dangers of smoking in the general population. But I'm not saying that for example, the main cigarette company in Trinidad and Tobago or the importers of cigarette are breaking the law. But I think it's a personal position I have. We have seen the dangers and the damage smoking does in the general society. So while they're operating legally, it's like, I guess, it can be compared to alcohol. Alcohol does a lot of damage also. The abuse of the use of alcohol, let me say, does a lot of damage also. But I mean, alcohol is legally available under certain circumstances in Trinidad and Tobago for adults to use. And we see the dangers of drinking and driving. There's a lot of public awareness about that. But there are some, what I would consider syntaxes that may be used as more of a deterrent to people engaging in these sorts of activities, although it is permitted legally once you're an adult and under certain circumstances.
Well, as somebody who is so passionate about this topic, do you have any data or any information regarding to how much it really does affect, especially the health of our young people?
Let me tell you, the smoking lobby is so powerful that if I pull up 10 studies now, medical studies in accredited peer-reviewed journals that indicate the dangers of smoking and the associated dangers and the strong correlations with cancer and other diseases, the smoking lobby will pull up 10 that says that there are other factors that are involved that are not being taken into consideration. So you can't directly pin carcinogens in cigarettes to cancer as an absolute 1-1 correlation. So I am well aware, because I've seen the Senate hearings in the US and also hearings in the UK and other jurisdictions that seek to control and manage cigarette and tobacco use generally. So, and the smoking lobby is so powerful and it's such a billion-dollar business that the smoking lobby or the companies will put up 10 or 20 studies or bring professionals to say that the studies that I have presented are not definitive. So that's to me not the way to go, because you're looking at, I bring 10, you bring 10, I bring 10, you bring 10. I think more effort and emphasis needs to be placed on managing the damage that smoking or tobacco, the use of tobacco products does to society in a more effective way. Because I don't think in a realistic sense it is going to ever be banned or outlawed in a country like Trinidad and Tobago.
Well, in that case, now, if we can't move to a place where we can ban cigarettes, what do you propose, or what are some of the ideas that you have in terms of curbing the use of cigarettes, especially among our young people?
More public awareness, more education, more going into the schools, some people who smoked. There was a time when a lot of adverts were created by persons who smoked all their lives and on their deathbeds. And some say it's a scare tactic. Yes, it is. But they were very effective in reducing the number of smoking or the number of minor persons engaging in cigarette smoking, because cigarette smoking is something that starts in teenage years, in some cases even younger than that. But if you look at much of the research, people are usually introduced to cigarette smoking in their teenage years through some relative or some illegal means they access the cigarettes, and then you continue smoking into your adult life. So I think more emphasis needs to be placed consistently so on education and awareness, public awareness, particularly in the nation's schools, primary and secondary schools, and in the wider population, and not only on World Anti-Tobacco Day, but on a consistent basis through the year, and introducing young people to more productive ways of engaging in life activities.
Mm-hmm. And especially since, a lot of people would tell you, they smoke because it's their coping mechanism. And for some reason, some of our people tend to go to those coping mechanisms that are on the negative side or on the self-harm side. How do we redirect some of our people to more positive
coping? It's a coping mechanism because it's been socialized into being a coping mechanism. You don't get up one morning and decide to smoke as a coping mechanism. You have to be introduced to cigarettes because, well, when you're 13 and 12, you feel you're a big man and a big woman and you could smoke. When your parents are not seeing you, and it's almost a social status symbol to be smoking as a teen, or in some cases as an adult. There was a time when smoking was depicted as glamorous in movies and in music videos. So you would find that it is socialized into you through multimedia inputs and also through your community engagements and in some instances in schools. So the way to counteract that is to go directly into the schools, directly to the young people in primary and secondary schools, and teach them and show them this is not as benign as you think. This is not as harmless as you think. It is affecting your body negatively, and you will pay the price in the long term.
To even do some advocacy on your own around in schools and so on?
I would love to, but it's kind of difficult to get into schools without the ministry's permission. But if they have a program, I'd love to participate. I will always make myself available if advocacy. And I'm not saying the ministry is not doing it. And I mean, let me not be erroneous in that, because the ministry does do some level of work. I've seen programs aimed at schools. I just think they need to be more and more consistent.
And what's been the response even from your fellow senators in when you brought these points up? Was this something that they agreed to, or did it resonate with them?
Some agreed very strongly, and some were silent because they may have other views, which is their right. But some people agreed strongly because they may have had personal situations, familial situations, and also friends and colleagues who smoked and suffered or were diagnosed with lung cancer, and in some case passes. I have 3 friends who were smokers since they were teenagers, and because they used to smoke in school when we on the football field or the basketball field or the volleyball field. I went to Hillview, and they would be smoking on honeymoon ground, and back then it still is in some cases the hip thing to do. And I know 2 out of the 3 passed away from complications of lung cancer and other cancers. So I don't know definitively that the smoking caused that, but I can proffer a guess that it had something to do with their prognosis and their demise in the end.
Mm-hmm. And, as we're getting ready to wrap up the conversation this morning, Dr. Richards, it's just very interesting, though, this comment continues to circulate even a few years after you originally made it in the Senate. Do you think that perhaps now it might have some weight?
I don't know. You see, I hope so. And as I said, I'm not trying to demonize tobacco companies, but I think we all know of the dangers of smoking. Tobacco companies would not have agreed to lawfully put warnings on cigarette packs if there was not some definitive information linking smoking to certain health issues in human beings or generally. I think what we've seen happen is that because there are other ways to encourage people to smoke that may not be illegal, and because smoking cigarettes are so widely available legally and in some instances illegally to minors, and now with the advent of the phenomenon of vaping, you are finding that there are different ways that the tobacco lobby globally is finding ways to keep their product viable under the hands of consumers nationwide. So the only counteraction to that is public education and awareness about the dangers associated with smoking, and being vigilant where that is concerned in terms of monitoring, in particular, minors getting access to not only cigarettes but vaping devices, which encourages them in the long run to smoke, etc., which is deleterious to their health.
All right, I want to thank you so much, Dr. Richards, for joining us and speaking on this matter. And hopefully we could have more of you in the future.
Well, I would love to come on in the not too distant future and talk about another one of my passions, which is the issue of disability rights and laws that protect the rights of persons with disabilities. I have the honor to chair a group of the Law Association Human Rights Committee, and we're working on legislation now to protect the rights of persons with disabilities, and we are hoping to come to Tobago very soon. Beautiful Tobago. It's always, you don't need an excuse to come to Tobago. Tobago is gorgeous and beautiful, and we are hoping to come to hold our 3rd consultation on the rights of persons with disabilities and the legal aspects of that. So we can hopefully have a discussion about that in the not too distant future. So pleasure being with you.
Certainly, and we're looking forward for that, and maybe then we can have you in studio because, of course, the conversation is
And
always
the
better
beach
when you
is
can be
not too
in.
far off.
Great. All
Thank you
right.
for having me, Kandace. Have a great day. And to you and your audience.
Certainly. All right, viewers. Well, we got to go for a break, but we'll be right back after this, so don't go anywhere.
It's a brand new morning, rise up to a brand